Good evening, all. This is the part two of the first topic in the unit two, basic first aid techniques. Basic first aid techniques as the following topics: assessing the scene and ensuring the safety. In this first topic is the part two activity. Here in this part two, I would like to uh, redo the same. As a part one, we have covered part of it, and the rest of the things will be covered for the same first topic. First of all, I would like to strengthen the basic first aid skills once again. This basic first aid techniques has some 8 skills. Let me again repeat. Every time I told you, these are the first. This is the very important part of this second unit. We will start with CPR, cardiopulmonary resuscitation. This is the very important task in this CPR. CPR provides artificial ventilation. Yes, it's a standby of ventilation to preserve brain function, blood circulation, and breathing. When somebody goes in unconsciousness, certainly this will support the CPR. Then Emlich maneuver can dislodge the obstructions from choking a person's airway. This Emlich maneuver is a second skill in the first aid technique, which will help the airway to be cleared. When there is a blocked airway, it will be cleared with the support of Emlich maneuver. Then comes splinting. When there is a fracture, certainly if it is not done immediately, certainly the fracture prolongs and there will be a severe damage. So immediately we have to bring it back to the thing and we have to take some first aid measures. That is, splinting a broken bone can prevent further injury and some to a certain extent when it is big open, the pain will also be very high. So if it's a pain, if the professional medical help is not available, certainly you have to splint it or you have to make it tie and see to it the further damage will not be there, preventing the further damage. Bleeding. Yes, you have to stop the bleeding within 10 15 minutes max. So, control knowing how to stop excessive bleeding. We should be able to stop the bleeding, excessive bleeding. So, bleeding, all of us know, within no time we'll become unconscious, or within no time we'll lose our life also. So, that's why when you observe there's a bleeding, certainly you have to check or you have to find out how to come out of the bleeding. Potentially with the target, which is a very crucial one, a person can bleed in as little as 10 to 15 minutes. That's a maximum. Then comes burn treatment, which is the fifth one. And the fifth one of the burn treatment is the first degree of the burn. Yes, the topical burn or the outermost epidermic layer. When there is a burn, it will be called as the first degree burn. This is a this first degree burn needs topical remedies and loose gas. That is what. Second degree of the burn is all the epidermic layer gets burned and it goes to the near the flesh. A little amount of flesh will also be taken out. That when it is there, we call it a second degree of the burn. Second degree of the burn requires some amount of cool water. You have to apply over the surface and see to it and similar treatment. While the third degree of the burn is still little expensive. It goes further penetrations. The top layer, skin layer will be vanished, and then the muscles or the nervous systems completely they get disturbed, and there is a little bit of disturbance further near the bone. That is what we call a third degree of the burn, which is very difficult to control. That needs medical attentions very much. Immediately we have to take them to a medical and refer it. Then comes concussion recognition. Yes, recognizing the concussion symptom like dizziness. Immediately when they go to the dizziness, lose the consciousness, lose the dizziness, and pupil dilation is important. When you are not treating this, this will take you a long term effect. This will have a long term effect, so it will not get recovered. Whenever there's a concussion recognition, immediately you have to treat it, get it treated. Then comes brain support. Brain support, we all know, strain is there whenever there's a muscular sprain, when somebody gets into compression or when somebody is doing a stretching exercise, stretching, when somebody is stretched too much, the elastic limit when it is going beyond the limit, obviously sprain will be there. Sprain benefit will be wrapped with an with an egg bandage. Egg bandage is the one we used to rotate over the place where the sprain is there, tighten it and see to it and elevate it little high and keep it for some time so that the sprain is getting recovered. That is the first aid measure. There's a protocol for that sprain, that is rice. What we consume, rice, the same rice. This rice is, first one is rice. We have ice. First, we have to rest in the RICE rise. First R refers to resting, rest the particular person completely in a floor and see to it is completely rested. Then keep ice in the place where the muscle is cramped or where the strain is there. Then comes compression. The last one is elevation. Rise is the protocol where it is rest, ice, compression, elevation. Last is suturing. Last suturing. Suturing is situations where medical help is delayed. Yes, when the medical help is far away, certainly in the first aid box you should have the suturing also there. So we may have to suture when something like bullet and other things penetrates the body. Sometimes when you immediately have to remove the bullet or the foreign object, when you remove it, you can expect a very big flow of blood coming out. By the time you may have to suture it. That suturing also is a technique to be learned in the first aid. That is what the last technique. A skilled first aid first aid forerunner should be aware of these things. Next comes the topic, first topic, assessing the scene and ensuring the safety. A part one of this topic has been completely completed. So let me recap some information of the assessing the scene and ensuring the safety. Uh, we have to check the scene. First is we used to have a protocol. That is what danger, removal of danger. It has a protocol as DRNS, DRS, ABCD. DRS, danger, response, sending the message, airway, breathing, after ABC, circulation, breathing, circulation, and coming to the D last. So we'll have the same protocol. First of all, you should ensure the scene, as I told you in the last part one. See to that you will not get into any kind of. So completely the danger should be completely eliminated. So when the danger is eliminated, certainly we can have a first part of the scene and ensure the safety is getting completed. Checking the scene, first step is providing the first to check the scene for safety. Danger is eliminated. Eliminating the danger. Look for any dangers that endangers you, the patient, and the bystanders. Let's remove the danger. So that was thought in the previous video. I continue the same from there. So as I told you, this DRS ABCD. This is what we will have. DRS ABCD. This DRS ABCD is the one which will, which is the action plan. Danger, response, sending the message, airway, breathing, then comes circulation, D. So let me come one by one by one. Yes, first is remove the danger, make the scene safe, and do not take any risk. Your safety is also very, very important. So your safety is paramount. Take that into first consideration. You should not become another casualty. That is also another thing you should keep in mind. Never ever you should become a, because of doing this first aid, you should not become another casualty. Identify any immediate dangers to yourself, the casualty, and any bystanders. So you should, if there is a danger, stop it and ensure the danger is completely cleared. Or if that is not there, then you start doing the first aid. That includes, these are the following seven things which we say in the danger examples. These things you have to put it away when you start your first aid. That is, first you have to see to it when it's happening in an accident, vehicular accidents, vehicle accident. When it is there, means traffic will be there in the road, that you should keep away from the traffic. When it is electricity related issues, you should put off the electricity and see to it. You are completely away from the electric. See if it is a electricity related accidents. Fire or smoke. Suppose if it is a fire or smoke related injuries, so you see it, you're far away from the fire and smoke, then start doing the first aid. Unstable structures. Sometimes we may have structures, temporary structures, which is made out of wood, and sometimes it is made out of temporary things. So those things will not be taken up like the normal buildings. So in that conditions, sometimes some damages will be there. So there you should come out of the subject place and go to a safe place. From there only you have to do the first aid, not in front of the unsafe or when it is unstable structure. Then come sharp objects. The sharp objects like knife, blade, all these screwdriver, any sharp objects, nail, those things. When it is a sharp object, certainly they will affect. So you should see to it that objects are far away. Remove those dangers. So that is the first one. Then comes hazardous substances. Hazardous substances, which includes chemicals and gases. So see it, those chemicals and gases are put away from the places, and you will be doing the study there. Hazardous substances. Then the last one is violence. Violent. When it is a violence, certainly when it is a violence, keep away from the violence and start doing the first aid. If possible and safe to do. So eliminate the danger. If possible and safe to do so, eliminate the danger, turn off the vehicle engine, switch off the electric supply to make the scene safe. Move the casualty. First of all, try to do the first aid in the spot where the accident has happened. Sometimes when it is these cases, you have to remove or you have to make them to go to a place where it is safe. So that is why casualty away from the danger and it can be done without causing any further harm. However, avoid unnecessary movement of the casualty. That's also very important. You should not move the casualty unnecessarily, especially when they have spinal injuries. Certainly, that injuries will also get extended or it will get further damaged. If the movement is essential, do the danger, do the danger immediately and try to keep the head in line with the body. Wherever you move the casualty, keep the head and the body in a straight line. That is very important. That's what every time you used to tell. The neck should be kept along with the body in a straight line. Neck and head. Then comes if the danger cannot be removed, consider whether it is safe for you to approach the casualty. Sometimes you will not be able to remove the danger. Danger when it is a natural calamity or something like that. Heavy rain, flooding, like that. Something like that. Earthquake, all these things. That you cannot remove it. Then you have to see it. You should be traveling in a safe posture and reach the spot and do the first aid. Do not put yourself at undue risk. See to it, you are not facing any undue risk. The risk is only, calculate risk only we'll be able to take and ensure your life is also very, very important. All of us have only one life. So see to it, you will not have any kind of taking a risk where you will be in trouble. So that is a very important thing. During the flying also they used to tell when you are going to have a oxygen mask, first of all, you should wear, then you can help others. That is the same only we are also repeating here. You should see to it. You should be safe, then you can help others. That is what. Look for any further damage once the immediate threat is assisted. See to it. If there is still danger, go back a step and reconsider your approach. If there is a danger, still danger is there, go back and reconsider your approach. That is what the danger should be completely eliminated before you start the first aid. As I told you many number of times, this topic assessing the scene and ensuring the safety. See to it. The first protocol is to remove the danger, DERS. Danger. Look for any further damage and the damage to be completely eliminated or removed in the surroundings before you start doing the first aid. Any hidden hazards also should be completely removed. Don't say I have not observed it. So that is why the scene should be completely realized. The scene should be completely taken up in the mind and see to it. Nothing we should forget and see to it the situation should be very safe for doing the treatment. Next comes the next protocol, response. Response, there are two types of response. One is if the casualty response, find out what happened by asking them. If they are responding, first you ask them what happened to you. If they are able to reveal it, it's good. At the same time, if the signs and symptoms are correct, then that is good. Try to work out what is wrong. If they tell what is wrong, from there you start working out and see to it, you will be able to set it right. Determine a treatment plan. Find out a treatment plan, APACA plan, or work out a plan. Then from there you start. Remember, if you are unsure, and always seek medical advice. When there is no response, if there is no response, immediately shout for help. When the person is not giving any response, if the casualty is not giving response, shout for help. Alert others to the situation and allows for assistance, including calling emergency services. Call 108, call 111, call 999. Alert. Make the people alert. Do not leave the casualty alone. Always be with the casualty until the until he gains the consciousness, until you get something concretely. Till then, you have to be with the casualty. Do not leave the casualty alone. Proceed to the next step while continuing to monitor them. Primary survey. Then comes the primary survey. Primary survey has two things. One is airway and breathing. Breathing airway is the primary survey. See to it, all the airways are clear and there is no disturbance. Then comes airway, the breathing. Whether the breathing is there, pulse is there, like that you have to check. Breathing. Then once the scene is assessed as safe, you may have to check a response. Response. You have to shout and you have to check for the response. But if the patient is responding, it's good. If he is not responding, then try all the possible measures. You have to take a AED, automatic external defibrillator. It's a part of this CFR. CFR is cardiopulmonary resuscitation. First, you have to focus on two things, that is airway and breathing. Before getting into circulation, ABCD, these two things are the prime things which you have to see, airway and breathing. The airway to be made very clear. That is the first plan. Open the airway by gently tipping their head back and lifting their chin. See to it the airway is clear. This Emlich maneuver, where the head and the body getting connected at the neck portion, the air pipe or the foot pipe, you can see that should be completely free from any obstacles. That's the very important thing. All the airways, including nose, mouth, ear, all these airways should be very clear. That is what the airway. Place one hand on the forehead and gently tilt the head back while using the fingertips on the other hand under the point of the chin to lift it. That is also you have to do it. See to it the airway is clear. Be careful not to overextend the neck, especially in babies. When they are a baby, not to extend the neck. That is also very, very important. You can go to the toe and you can rub them. So sometimes they may get the consciousness. For unconscious casualty, where the neck injury is suspected, use the jaw thrust method to open the airway without moving the head. So when the casualty is with the neck injury, do not try this. Just go to the jaw thrust method, open the airway, open the jaw, and from there jaw you just do a breathe and start them take the consciousness. To do this, place your fingers behind the angles of the casualty's lower jaw and gently push the jaw forward. That is the technique you have to do it. Place your fingers behind the angles of the casualty's lower jaw and gently push the jaw forward and backward. Be aware that it is an unconscious causality. The airway can be obstructed by the tongue sliding back. Sometimes the tongue may also block the airway. So see to it, it doesn't do, it is not done by the tongue. And they should not, sliding, vomiting should not be there. And there should not be any fall, there should not be any foreign object should not be there in the pipe. Never put anything into the unconscious. Don't put anything. Don't try to use any kind of tools or something like that to the airway. Never put anything into the unconscious casualty's mouth. Next comes out. Then the B is breathing. How we do? Check if the breathing is normal. And should check the pulse, check the breathing, so that the breathing is normal. You can use a stethoscope and do it. Only medical people are aware of this. So you can very well touch and see if the pulse is there. Breathing. And breathing can be sensitized. You can keep your finger under the nostrils and check whether the breathing is normal. After opening the airway, look, listen, and feel for normal breathing. After opening the airway, airway is clear. Look at them, look at their eyes, listen to their breathing. That is how the breathing, inhale and exhale, and feel for normal breathing. You'll be able to realize the feeling of the normal breathing that is there. Place the back of your hand near the nose and mouth to feel the breath. As I told you, place your hand near the nose and mouth to feel the breath. Yes, very well, you can be able to realize when the person is inhaling and exhaling. You can keep your hand finger near the nose and check and you can find out. Look for chest movement. Then you can also keep that pulse movements and the chest movements can also be observed in the hand as well as over the chest where it is giving a laptop. That can also be look for the chest movement. That is also a technique to check whether the breathing is normal. Listen for the sound of breathing. Yes, as I told you, over the heart, you place your finger, or place your heart, or place your ear, and see to it. The sound of breathing is normal. Look for about two breaths for every 10 seconds. Within 10 seconds, there should be a two breath. That is what we say it's a normal breathing. So when there's a two breath is being sensitized in 10 seconds, certainly that person is normal. Then if the casualty is breathing normally, their heart is working and the blood is being circulated around the body. That's what you can confirm. If the casualty is breathing normally, even though they are not responding, if the casualty is breathing normally, the heart is working. You can very well confirm the heart is working. and the blood is being circulated around the body. If the casualty is unconscious but breathing, you must protect the airway by placing them in a recovery position as soon as possible, unless a spinal injury is suspected. If there is no spinal injury, spinal injury is not there, or spinal injury is not suspected, you can, if the casualty is unconscious, but but he is breathing or she is breathing, you must protect their airway. Certainly, you have to protect the airway by placing them in the recovery position. Recovery position is you have to keep them flat, flat. No, you cannot put it in a pillow, or you cannot have the front and back in an elevated position. Everything should be flat in one line, and the fingers should also be placed flat, and like everything should be kept flat. Then the recovery position helps to keep the airway open and allows the fluid to drain from the mouth. When there is a recovery position is there, means it will certainly help the airway to get open and allow the fluid to drain. If the spinal injury is suspected, when there is a spinal injury, the spinal cord is suspected, try to get someone to hold the head in line with the body. When you turn the casualty and minimize the spinal movement, that is what, if there is a spinal injury suspected, means you do the first aid at the spot itself. If the casualty is not breathing normally, you will need to reconsider the rescue breaths and chest compressions. If the casualty is not breathing normally, then you have to start either AED or CPR. You may have to start immediately and rescue the breath and chest compressions. That is very, very essential if you are a trained person to do so. If you are a first aider, so start doing this. If you are unsure of giving rescue breath, you can perform chest compression only. You can only do the chest compressions. If you are not able to give the breath, then you can do only chest compressions. So to gain back, resuscitation as the last resort. Chest compression only, that will be the last chance if all the chances are fails. Then comes the secondary survey. Do a secondary survey, ensure the person is breathing, but there is a little congestion is there. Once you are satisfied with the casualty is breathing normally, you can move to the secondary survey. That is what secondary survey says. When the casualty is breathing normally, you are confirming the breath is normal. Once the breath is normal, but still he is not conscious, unconscious. The person is not in consciousness and he is in unconscious state. If that is the case, you have to move him to a safest place and make a detailed assessment of the casualty condition. Take him to a safe place and ensure the casualty condition. What is the current conditions? It should be in the order. The order of importance of secondary survey is generally, first of all, the survey starts with the three B's. First is breathing. Ensure the person is breathing. There's no bleeding, internal bleeding, external bleeding, nothing, no bleeding should be there. The last one is bone. These are three one line statement with the three points, the three step. Breathing, bleeding, bones. Breathing, bleeding, bones. First, breathing, we have discussed in length about it. Then come to the point of bleeding. Bleeding, check the casualty from head to toe. Is there any internal damage? From there, any bleeding is there. Stop the bleeding immediately, including the undercovered areas like the back. Suppose if it is not visible, still you have to check and you have to stop the underbleeding. Stop to control any bleeding if you find by having a direct pressure, elevation, and the pressure points. By doing these things, stop the bleeding. Immediately arrest the bleeding. Do not leave the blood to go. Next, head and neck. Check for any check for any bruising, swelling, or bleeding, particularly from the ear. You have to check to the ear very clearly, thoroughly. You have to light and you have to see to it. There is no fluid and nothing is there in the ear. Then you can start, as a first aid, you can just proceed further. Be aware of potential spinal injuries. Be aware of the spinal injuries there means certainly you will not be able to do move the person or do something. That is still again a risk. When if the casualty has been in the accident, likely to cause such damages. So, especially if the casualty has been in an accident, likely to cause such damages. That is the one. If he is having a spinal injury, the last is bones. After dealing with breathing and bleeding, assess for the broken bones. So if there is a bone is broken means take measures. Splinting can be done. Further fracture should not be there. So look for deformity, swelling, pain, and inability to move the limb normally. Any of the limb, whether it is a leg or hand, that limb is not able to move normally. You can confirm there is a fracture or there is a issue with the bone. Then comes additional safety considerations. So we'll also check for the additional safety considerations. Additional safety considerations, preventing cross infection. That is the next point, preventing cross infection. If possible, use protective gloves when dealing with the casualty. Even though you do with the gloves, after inspecting everything, you have to wash your hands thoroughly. In giving rescue breaths, use a face shield or with a kerchief. You just cover his mouth, cover his complete face, and use your mouth and do it as per the training. In giving rescue breath, use a face shield or alternative barrier like a piece of plastic with a hole or handkerchief or any piece of material to prevent the direct contact. That should not be there. Mouth to mouth contact should not be there. You use something in between and start having the contact. That is your bacteria. And other thing should not enter the other person, and these bacteria should not come to you, vice versa. To avoid that, only we always cover it with the handkerchief or with cover with something other matter, and then start doing the breathing. Then again, after every treatment, you have to thoroughly wash your hand. Thoroughly wash your hands after providing first aid, even if you have used gloves. Even you are using a gloves also, thoroughly wash and start the procedure. Next question. Be aware of the sharp objects. If the casualty he faces any sharp objects nearby, as needles or a knife, at the same time, loosen any restrictive clothing, such as ties and belts. When it is there in your body, you have to immediately lose those garments and make them free from those ties and belts. Then comes the consider the mechanism of injury. The mechanism of injury is again a good part of this topic. Mechanism of injury to help determine what injury the casualty may have sustained. Understanding how the injury occurred, and you can provide valuable clues. That is what is being given. You also try. Then again, loosen any restricted nothing. Consider the mechanics of injury. To help determine what the casualty, what type of injury is having, the casualty may have sustained. Understanding how the injury occurred, that is also very, very important. You have to understand the injury, how it has occurred. From there, you will get so many clues. If the casualty is unconscious, do not move them unnecessarily. Do not move them unnecessarily. When the casualty is unconscious, never ever moving here and there. That is important. Then again, as it would lead, as this would lead cause further injury. If the casualty is unconscious, certainly do not move and take them to next level. Never place anything under the head who is on their back, as this will obstruct the airway. Do not keep any sharp objects and do not keep any objects under the head. So this will block the airway. So do not keep anything, elevate panading. Just keep the head flat without pillow. Just keep in line with the body. Second is by following these steps to assess the scene and ensure the safety, you can provide effective first aid by minimizing the risk to yourself and others. Last point I'll tell you. Remember that this information is a guide. It is not the complete trainer certificate. It is just to know about it. From there, a hands-on skill, hands-on experience to be gained, thoroughly gained before you do this as a professional. Remember that this information is a guide and the hands-on training is essential for developing the skill and confidence to act in emergencies. Yes, that is very much you have to agree. Even though you might have studied this thoroughly there in the 12th, still you have to You have to gain the training from the first aid courses. These are the topics we used to have. All these information is only a guide, and the hands-on training is very essential for us to deal with the patient or the person who is affected. Then you can very well go with this DRS ABCD. That is a technique: airway, breathing. The first one is DRS. That is danger removal response. Then S is sending messages. DRS. ABCD is ABCD is again I repeat ABCD. ABCD. Airway, breathing. C is again the congestion to be removed. Then the last one is D. Decision. With this, I'm stopping here. Thank you.